Are you part of 80% of American adults who suffer from back pain? I'm Samira, and I'm going to help you fix that today. In this beginner-friendly workout, you'll learn 6 strengthening exercises and 3 essential stretches that have helped thousands of my students find relief over my 39 years of teaching. Try these with me now so you'll instantly know how they work with your body and how they make you feel. All you'll need is a soft spot on the floor and a yoga strap or a bathrobe belt or something like that. By the end of this video, you'll not only feel better, you will be learning the tools to help you continue your healing journey. Let's go. First, we're going to learn how to activate your transverse abdominal muscles. This is just the really short version. Sit wherever you're comfortable. You can sit on the floor. If that's not comfortable, add a blanket for a little more space for your hips and knees, or sit on a chair or couch. For this part, you can sit wherever you like, where you're comfortable. And I want you to sit up tall and lifted. Relax those shoulders down. Now place your hands on your lower belly, below your belly button. First, we're going to do the opposite of compression breathing. So we're going to inhale and let your belly expand. Expand your belly like a balloon. Now, as you exhale, firmly exhale, pretend there's a string drawing your lower belly backwards. So draw back, draw back, draw back. And the hand still on your tummy should feel a little bit of movement. Now you are engaging those transverse abdominals. We can add in a pelvic floor lift. I'll explain that in another video. It's kind of like a Kegel contraction. And stay scooped, drawing your belly back. That's what I mean by staying scooped. Keep your pelvic floor lift going and take a breath in. And strong exhale out. With that strong exhale, you should feel those muscles work. If you don't feel them yet, that's okay. I can help you. Keep one hand on your tummy, put one hand in front of your mouth, and you're going to cough. Your hand felt those muscles jumping, right? Those are the transverse abdominals. Those are the muscles, some of the muscles that we need to strengthen. Let's go. Come down on the floor with me. Lengthen your spine, have your knees bent and your feet flat. We're going to raise the arms in the air, turn your palms to facing each other. We're going to put dead bug together, first upper body and then lower body. So you're going to reach the right arm back and bring it up, and reach your left arm back and bring it up. And you'll notice one shoulder might be more flexible than the other. Keep this comfortable on your body. Modify as you need. Inhale on the way back, exhale on the way front. Now, I want you to watch the hand that is staying still. Are you keeping it perfectly still? Your palms are facing inward toward one another. Excellent. Lower down. Now, the legs, raise your legs up to tabletop position. And a tabletop position is a 90-degree bend at the hips, a 90-degree bend at the knees. You have to work those transverse abdominals to keep your back stabilized. And that is the goal in a lot of exercises I will teach you, stabilization. So draw your lower belly towards the floor. Notice I'm not pressing my back into the floor. I'm just drawing my belly towards the floor. Add in your pelvic floor lift. The most common thing that people do here is bring your knees in just a little too close. And then you're not going to feel any work. You do want to feel some work here. If you feel it more in the tops of your thighs, scoop those abs more. So the legs are harder to do by themselves without the arm balancing them. Straighten your right leg away from you and in, and away from you and in, and away from you and in. Notice I'm not straightening right up to the ceiling. Good. All right, now lower the feet. Relax. We're going to put those two things together, and it's going to be opposite arm and leg moving. The hardest part in this at first is the coordination, but you'll get that with practice. So raise the arms up, raise your legs to tabletop, 90 degrees, 90 degrees. Draw your lower belly towards your spine, add in your pelvic floor lift. So right arm and left leg. Inhale, reach to the opposite walls. The other arm and leg stay still and bring it in. Take your time, left arm, right leg. Inhale, reach and stretch. Exhale, bring it in. Stay scooped. Inhale, reach and stretch. Exhale, bring it in. Inhale, reach and stretch. You got it. Good. Now, if you want to modify, instead of straightening the opposite leg, you tap the toes down to the floor. So you can do it as I'm doing it now, tapping my toes to the floor. If you're doing toe taps with this, you want to be mindful to keep those knees at 90-degree bend. So I won't be bending my knees deeper than 90 degrees here. Let's do one more set. Inhale, strong exhale. Last one, inhale, strong exhale, and gently bring those in. Nice. From here, we're going to do presses. And so you're going to raise your legs again to that tabletop position, 90 degrees, 90 degrees. Scoop those abs, add in your pelvic floor lift. Reach your hands to your legs. Now, we're all different. I've got short arms and a long torso, so my arms can be almost straight. Some of you are going to have your elbows bent much more than me. Either way, the thigh is vertical. Scoop those abs, pelvic floor lift, relax your shoulders, and keep your arms braced and pull your legs up into your arms. Pull, and we're going to hold, 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 and relax your legs down. Take a breath. Exhale, release it out. Nice. Make sure you keep your neck long, front and back. Raise your legs to tabletop again, 90-90. Arms are going to brace, shoulders away from the ears. Scoop the abs, pelvic floor lift, and brace the arms and pull your legs into your hands. Pull, pull. Feel your abdominal muscles working. Some hip flexors here too. Pull. Scoop the abs. Pull, 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 and relax down. Take a breath. Let it out. Good. Let's do that one more time. Raise your legs to tabletop. Scoop those abs so you're stabilizing your back. Brace your hands and pull in, pull in. Keep going. Pull in. Relax your shoulders. Nice. And lower those legs down. And you can sway your knees side to side a couple times. All right, continuing on, still on our back, we're going to do some bridge work. And I want you to be careful of your foot and leg position. Keep it comfortable on your knees, but you want your feet about hip width and maybe a little bit wider. And you want your shins vertical. The most common issue that happens here is the feet way out and then your hamstrings try to take over. So have your shins approximately vertical. You got to bring your heels somewhat close to your sit bones here. Turn your palms to facing your body. Reach your fingertips toward your heels. Broaden your shoulders. Lengthen your neck. We're going to squeeze our glutes and curl our tailbone away from the floor. We're going to roll up through our spine. So roll up, 2, 3. Broad shoulders, 4. Roll down, 2, 3, 4. Squeeze your glutes. Roll up, 2, 3. Broad shoulders, 4. Roll down through your spine, 2, 3, 4. Good. So if the roll up is not comfortable for you, go really gentle on that. For most of you, it will feel good. Squeeze your glutes. We're getting glute strength and spine mobilization. Roll down, 2, 3, 4. Good. Squeeze and roll up. Motion is lotion. Your feet are flat on the floor, but I want you to feel like you're pushing your heels extra into the floor. You'll feel more strength. The back of your body will work more. Good. Keep going. Squeeze, roll up. We can add one more tip onto this one. Imagine you're holding a yoga block between your knees. So your knees can't move, but I want you to squeeze your yoga block. You feel more muscles working? Good. So you should feel your glutes work. You should feel your inner thighs work. You're getting back mobilization. Let's do one more. Rolling up, 2, 3. Broad shoulders. Roll down, 2, 3, 4. Excellent work. Relax. Alrighty, for our next one, we're going to bend our elbows to 90 degrees. Your arms are by your sides and your feet are still in that vertical shin position. Spread your toes a little bit. Push your heels extra into the floor. We're going to squeeze our glutes and lift your hips up. Now you can brace your elbows into the floor as much as you need. This one is going to be a little easier if your feet are a little closer together. And this is called marching. Let's raise our knee up one at a time. Raise your right knee and down. Raise your left knee and down. Good. Broad shoulders. Broaden your shoulders into the floor. That keeps pressure off your neck. When you lift one leg, push the other foot into the floor. Lift and push. Feel how you can emphasize those muscles in the back of your body working. Strengthening muscles all along the back of your body helps prevent back pain, according to the very latest studies. Glute strength also helps with lower back, hip, and knee stability. Let's do our last one. Good. And relax all the way down. Lengthen your spine, release those shoulders, bring your knees in, hands on your knees, and just gently sway side to side. Now we're ready to stretch out the front of our body, help our discs and SI joint go back into place, and strengthen the back of our body. This will help with disc issues, SI joint issues, some sciatic issues, and also posture. Let's go ahead, come down to your forearms on the floor. I want you to turn your palms to facing each other, make fists, and brace your arms into the floor. Shoulders away from the ears, long neck. So just here is a fantastic rest position. You can stay like this for several minutes, and it helps your discs go back into place. Just gravity does the work here, not even you. So that's kind of awesome. But now let's turn our palms to the floor, shoulders away from our ears. And keep your hips on the floor. You want to press up, press your hands into the floor, shoulders away from the ears, long neck. Turn the backs of your arms or your elbows toward the floor. And relax all the way down. We're going to do that a few times. Press up. So you might only press up an inch or so. You might press up higher. You can come up as high as is comfortable for you, where you can still feel your hips and thighs on the floor. Good. So you don't want to lift your hips up off the floor any extra. Your hips and thighs are on the floor. Let's come back down. Shoulders away from the ears, long neck. Make sure you're not looking down to the floor. You're going to look forward, not up too high. It's probably down at the baseboard somewhere, low on the wall in front of you. And press into the floor. Those of you who are more flexible, you can absolutely walk your hands closer. Let's all draw our shoulders away from the ears. Keep your neck long. Take a deep breath in. And as you slowly exhale, slowly, gently let yourself down. Nice. For this next one, we're going to be on all fours. And I want you to be mindful to have your arms vertical and your thighs vertical. Your wrists are beneath your shoulders, knees are beneath your hips. You can have the tops of the feet or toes on the floor, however you like. Turn the backs of your arms towards your thighs. Feel how that rotates your shoulders out. Keep your head in line with your spine. It's really common to have your head down too low. Let's draw our belly button up to our spine. You want your whole spine long and flat. Pointer dog stretch. This is right arm and left leg. So opposite arm and leg. You're going to reach out, get your balance first at your fingertips and toes. Lift just to a straight line and down and in. Left arm, right leg. Inhale and stretch and down and in. Keep going. Stay scooped. Good. Make sure you're breathing. Stay scooped. Inhale. Stretch. Nice work. Reach and lengthen. And reach. So here, you want to keep your hips square to the floor. We're strengthening muscles called your multifidus muscles here. These muscles prevent compression of your spine. What that means on a practical level is these muscles help to keep your discs and your vertebra healthy. These muscles help support longevity of good posture. And these muscles that you're strengthening right now also help your balance. Stay scooped. Excellent. Let's finish up on the left arm, right leg. Fantastic. Alrighty. Let's come to our back. Grab your yoga strap or bathrobe belt, but place it right next to you. We don't need it for the first stretch. We're going to start with a hip flexor stretch. 3 common contributors to lower back issues are tight hip flexors, tight hamstrings, and tight piriformis. Let's get to stretching all of them out a little bit today. First, Draw your left knee up towards you. Slide your hands behind your knee and draw the knee up towards your shoulders. This is an active stretch. Broaden your shoulders, lengthen your neck. As you draw your knee up towards you, notice what your lower back does. It kind of anchors down to the floor. So you want to maintain that and slide your right leg away from you, down and long. So here you want to feel gentle stretch through the front of that right hip. Breathe deeply in, broad shoulders. Slowly let it out. Good. Do it again. Breathe all the way in. Left knee up, right toes away from you. Try to touch the wall that's far away from you. Nice. Let's do the other side. Lower that left foot. Bring your right knee up. Slide your hands behind that knee. Actively draw the right knee up. Broaden your shoulders. Lengthen your neck. And slowly, be kind to your body. Slide that left leg all the way down, nice and long. Broaden your shoulders. Lengthen your neck. Lengthen through that left hip. Take a couple breaths here. Thorough breath in. Take your time on the way out. Good. And again, breathe in. And slowly, slowly let it out. Nice work. Let's pick up your yoga strap. Bend both knees. Place your feet flat. Put your right foot up into your yoga strap. And what I want you to do, put the right foot up into the middle of your yoga strap or belt, and I want you to lower that right leg away from you. The left knee is still bent. Lower the right leg away from you. Find where you can have a hinge in your hip and a hinge in your ankle, but no hinge in any direction in the knee. Modify if you have orthopedic issues, of course. But if you can, I want you to engage your quad like you're going to try and draw your kneecap towards you. You're not pushing backwards, you're drawing up towards you. And then you don't have to think knee close to your nose. I want you to think lengthen the back of that right leg. So reach your sit bone down to the floor, reach your heel up to the ceiling, relax your shoulders. Soften your belly, soften your face. If you want a little more stretch, slowly slide that left leg all the way down. And let's breathe here. Imagine you're breathing into the back of the leg. And exhaling softness. Exhale, release tension. Do that again. Breathing in like you're softening the back of the leg. Exhale, reach the heel to the ceiling a little more. Relax the shoulders a little more. Nice. There's many variations of this. I'll show you more at another time. Let's bend both knees. Pick up your left foot. Sneak your left foot behind the right. Release the right leg all the way down. And again, start with your left leg lower than you normally do if you've done these before. Find where you can have a hinge in your hip and a hinge in your knee, but no hinge in any direction in that knee. You can engage the quad like you're trying to draw your kneecap up towards you. Relax your shoulders. And then if you can keep the knee extended but not hyperextended, then you can change the angle of the hip. But notice I'm not pulling in so close that I bend my knee. And let's slide that right leg all the way down. And take a couple breaths here. Fill all the way up. Relax it out. Good. Keep going. Notice my hands are pretty close to me. If you reach way forward, your shoulders are going to be away from the floor, and that's going to pull your neck away from the floor. Keep your hands down, and then imagine your shoulders are heavy and your elbows are heavy. And take another deep breath. And exhale. Let it out. Nice work. Alrighty, let's move on. Your piriformis stretch. You're going to put your yoga strap behind your bent left knee. With your yoga strap behind that left knee, put your left foot down. Keep your left foot on the floor. Pick up your right leg And cross your right ankle over that left knee. Open that right knee to the side. So find where this is comfortable for you. Relax your shoulders down, keep your sit bones down. Before we go into the piriformis stretch, we're going to move our knee. Your right knee, bring your right knee over that left hip and press it away. Do it again. Slow motion, like a slow motion butterfly wing. Motion is lotion. Your joints love movement. Keep this comfortable for you. Good. So press the leg away. And if you feel a stretch deep in the right glute hip area, then this is your place to stay. If you don't feel a stretch here, use the yoga strap to draw your legs up toward you. I want you to keep your shoulders heavy and your sit bones down. Your piriformis, where you want to feel a stretch, is deep in your right glute hip area. You might also feel it in your IT band down the leg. Totally fine too. Relax your shoulders. Notice my shoulders are down and my butt is down. A lot of people use your arms and you curl your back off the floor, and I've had students strain their back doing that. You don't want to do that. That puts pressure on your lower back. To stretch this muscle, you need a hinge in your hips so your sit bones stay down. If you don't feel a stretch here, try this. You can gently ease both legs just an inch or two toward the left, so an inch or two toward the side with your yoga strap, and then you'll change the angle of the leg into the hip, and you'll feel more stretch. Always stretch where it is comfortable for you. You can ease your feet in circles if you like here. Breathe all the way in. Exhale, let it out. Excellent. Let's go to the other side. So you are going to put your yoga strap behind your bent right knee. Put your right foot down. With the right foot down, cross your left ankle over that right leg. I always put my foot underneath the yoga strap. That's not necessary. Stay here. Right foot is on the floor. Shoulders are relaxed. Breathing is deep and slow. Slow motion butterfly wing with that left knee. Draw it in and across and press it away. Draw it in and across and press it away. Your joints love and need movement. Now press the knee away. Stay here and modified. If this is where your stretch is, this is what's good for you. If you don't feel a stretch here, use the yoga strap. Keep your legs relaxed. Draw your legs up toward you. Shoulders are relaxed. Sit bones are heavy. Face is soft. And again, you can ease your legs an inch or two toward the right, toward the yoga strap side, if that's where you feel your stretch better. But keep your butt down, keep your sit bones down. Breathe all the way in. And slowly, softly, take your time on the way out. Excellent. Take a moment, notice how you feel right now. You should feel at least a little bit of easing. Come back and do these with me 3 more times this week, and then let me know in the comments how you feel. Also, let me know if you have any questions. Thank you so much for joining me.